Welcome back to 3+U. As we age, and I'm getting there, quality of life is something we're very concerned about. Here to make sure that we maintain high quality of life, Dr. Tim Ballard. He's with the Center for Sports Medicine, Orthopaedics, and knees, hips, making sure that those are not just in shape, but that they are as high functioning as possible is paramount to that quality of life. Doctor, tell me about it.
Well, absolutely. I mean, what you find out as you get later in life, not only from you enjoying your life, but also being healthy, is that you want to stay active and stay mobile. And so as we're seeing the patient continually age towards what should be an average life expectancy of 90 within this next decade, it's important to keep people moving. So they're going to see more and more people that are needing new hip and knees so that they can stay active and stay healthy. In fact, there's been interesting data published not so long ago to show that at 3 months, the average patient has a measurable increase in their heart and lung function 3 months after having a joint replacement, because you can go out and do things.
I think a lot of people see a knee or hip replacement as a negative thing, something to avoid. They don't want to do it, and so they'll hobble around as long as they possibly can. But there are a lot of reasons now to go ahead and get it done, maybe even a little bit earlier in life than before.
Sure, when you get to the point that it's adversely affecting your life, then that's the time to think about doing something. And of course, we want to exhaust all the non-operative options first. You don't just come in and say, I'm here to get my knee replaced. You know, first I want to talk to you a little bit about what arthritis even means. Of course, it's just defined as wear and tear or inflammation in a joint. That can happen just through a wear and tear degenerative process. It could be post-traumatic. It could happen from an inflammatory disease. But one way or another, the end result is when you wear out the cartilage on the ends of the bones so that you're rubbing bone on bone. That's when you get into a situation that becomes debilitating. Early on in the inflammatory process, when you've got somebody with a little bit of wear and tear damage and a lot of inflammation and pain, they may respond to an anti-inflammatory medication. They may respond to an injection. In certain situations, a brace can help. Physical therapy can help. I do arthroscopic surgery. So if somebody has a torn meniscus or has a certain amount of mechanical problem in a joint, but it's not completely bone on bone, they may respond to arthroscopic surgery.
Center for Sports Medicine, but a lot of the sports medicine applies to us just in general as we age, doesn't it?
Sure, absolutely. And as our name implies, sports medicine and orthopedics, a lot of people enter the orthopedic treatment arena, if you will, through a sports situation, but there's more and more people that means later in life. So maybe you were involved in sports 30 years ago and now it's time to come do something.
And that brings up a good point, preventative. Are there things that we can do now? I would imagine that a lot of times we're having trouble with our hips, with our knees, because of the way we've just in general lived our life, whether it was from sports, wearing bad shoes, running incorrectly, whatever, over a period of 20, 30 years. It's going to mess up your knees and hips. Anything preventative you would tell people?
Well, there's certainly things that you can avoid. Obesity is associated with early onset wear and tear arthritis in the knee, so every pound that you weigh puts 4 additional pounds of pressure through the joint.
Really? Wow.
And then there are certainly occupations. You know, if you're laying tile or carpet for a living, you want to take the time to get good protective knee wear so that you're not putting direct trauma on your joints. The other thing is that you want to have a good diet that's got plenty of vitamin C, which is important to the generation of collagen, which is the backbone to your cartilage. And then the other thing is you want to pick good parents. So a lot of it's genetic, but you want to make sure that you're predisposed to having good joints.
And doctor, I know that you have replaced, what is it, 20,000? 20,000
coming up on 20,000 joint replacements this year.
That is incredible to me, and I want you to talk just about your philosophy, because when people think joint replacement, they think Center for Sports Medicine. And so what is the philosophy? How have you been able to be so successful?
Well, I'd say my personal philosophy is you treat every patient like they matter, you know, and they do. So I'm thankful to have this opportunity to get to help people. I think it's been a very gratifying field for me when somebody comes in and they can't walk and they leave and they can walk. I'm thankful for that. And I would be remiss not to say that, frankly, when I came to town, I prayed I would have a busy practice and feel like I've been blessed with that, and I'm humbly grateful for it.
A lot of times it's be careful what you pray for, because God just may hear you and answer it. And
exactly.
Oh, okay, that's enough, that's enough.
Exactly.
The first time I ever experienced someone with a knee replacement surgery, Bobby Cox, manager of the Atlanta Braves, he was known for just hobbling and walking out to the mound. And then he had a knee replacement surgery. The next season, he would run out to the mound. Right. So you see that every day, don't you? People just don't understand how much better it can be.
Yeah, one of my favorite examples, my dad, about maybe 6 weeks plus after getting his joints replaced, showed me how he could walk without any pain. And a year later, when he and Mom came to visit, he pulled into the driveway, took me by the hand and said, "Let me show you something." And he took me by the hand and ran down the driveway with me just to show he could run at 78
Really?
years old. So that was personally very gratifying.
Now, big question, because of the father-son relationship.
Sure.
He didn't let you do the surgery, did he?
Well, since I've opened that can of worms, when he told me that he needed his knees replaced, I said, "Well, great, I know who I'm going to send you to." And he said, "Oh no, you're going to do it or the deal's
Really?
off." So,
Really?
yeah, but I took a partner with me.
Yeah.
And I will tell you, once the surgery started, it was just kind of like normal business. The
Forgot it was your dad.
Yeah, the most difficult thing, I'll be honest with you, about operating on my dad was praying with him before surgery. But once I got through that emotional turmoil, then I was fine.
So Dr. Ballard, I know there's a lot of advancement in joint replacement. What are some of the big things going on right now?
Well, I'll tell you, the three most exciting things to me have got to be the increased longevity of the prosthesis, which makes it available to people at a younger age and lasts much longer. Our changes in perioperative management and how we handle pain after surgery, and also the effect of reducing hospital stays. So we have a lot of patients that are in the hospital for less than a day now. Sometimes it's the same calendar day, but certainly less than 24 hours. As far as the longevity of the prosthesis, we used to think you were fortunate to get 10 years out of a hip or a knee replacement. Now, with the newer cementing techniques in knees and with the prostheses in hips and knees both, we expect you to get multiple decades out of it. And also, as far as perioperative pain management, do you know the majority of my patients now don't go to sleep anymore? We put a shot in your back and a shot in your knee, and then I inject it with some local anesthetic agent at the time of surgery. And I have a lot of patients that tell me they have little or no pain the day after surgery. So those are the most exciting things to me. It's changed the world.
And it's changing a lot of people's lives as well. Dr. Tim Ballard, Center for Sports Medicine, orthopedic surgeon, and you want to make sure you get in touch with him. There's the information, Macaulay Avenue, 624-2696. All of this information also online, sportsmed.com. Dr. Ballard, thank you very much. I appreciate it. And we are back. More 3+U right after this.